Okay, for those who are online, you didn't miss anything. We are just sharing the Wi-Fi password here in the room and getting started. Here is our agenda for today. And to get us started, we have, nope, there we go. Okay. Technology is clearly my strong suit, so bear with me for the day. We are going to start with a little, some polling questions. We use menti.com. You can use your cameras to scan this QR code, or you can sign into Menti via the web at menti.com. Enter this code. This is just to get you warmed up for the day and excited for our presentation. So I'm going to give it just a second to let you all scan that. And then, okay, here's the challenge. Here's the technology challenge. In order to bring up the polling, I have to go do this. And remember where in the heck it is. Okay, Natalie, do you know where'd you bring this up? All right, it looks like people are able to sign in. I see a bunch of thumbs up. Okay, did anyone know it's National Nutrition Month? Thank you to the two dietitians in the back of the room. March is National Nutrition Month. So here's the question. Do you happen to know the date for Registered Dietitian Nutritionist Day? I love the no and no clue. Well, you're close. For those of you who did not know, it was yesterday. So you can thank your friendly registered dietitian nutritionist for everything they do to support nutrition and access to healthy food.
I think this is a hint. It's Shelley's and RD.
Shameless plug for dietitians. They just made it so easy for me. Okay, next question. Did you eat a fruit or veggie this morning? I hope everyone in the room says yes. Nobody?
You can't submit.
Yeah, you can't submit it.
The sponsors are off. Maybe where that press C.
This is really for your entertainment.
There we go.
We do this for entertainment
Oh, there you
purposes. That's why we have and we do this to check our technology and make sure we can get multiple screens to work before we actually get into the presentation. So most of you, yes, outstanding. Anything fresh or local? Do you know? Those of you who are in the room. If you ate our breakfast here, you can assume at least part of it is local. No, probably not the oatmeal. Okay, and did you all know that the Big 12 basketball championships took place this week? Women's was first, it's over. Men's are currently going on. Who won the women's Big 12 basketball tournament? And don't look it up before you put your answer in. I can almost guarantee Robin knows who won the Big 12.
Source subject.
Sore subject, yes. Oh, there you go. There's our answer. Should have been Iowa State. So for those of you who don't know, it was Iowa State and I believe Texas who were in the final for the women's. Iowa State sadly did not come out ahead in that one. But for those of you who aren't aware, that's just to highlight how much local, how much national recognition we get for local events that take place. And they just announced, I think the Big 12 is going to, the championships are going to remain in Kansas City until 2031. Okay. So that's also exciting and has a lot to do, relates a lot to the work we're doing for the Kansas City Physical Activity Plan. Okay. So we're going to see if we can do this again. We're going to stop sharing. We're going to go back to our presentation. Oh, wrong presentation. Okay. There we go. Well, I'm gonna pause on sharing this for just a second. Because what we're really gonna do right now is just introductions, and we'll share the screen again once we have our speakers come up for their presentation. That will save me a little pain and suffering as we record the meeting, and my technology skills are on full display. So I would like to take a minute to let everyone introduce themselves, both by name and the organization that you represent. We'll do it in person first, and then we'll go to those who are online. I think it's great for the presenters to know who they're speaking to, but I also think it's great for those of you who are participating to know the type of people who show up and to think about what types of connections you can make as a result of this meeting. So I'll go ahead and start. For those of you who don't know me, I'm Shelley Summer. I am the program manager for the Kansas City Healthy Lifestyles Collaborative. The collaborative sits at the Center for Children's Healthy Lifestyles and Nutrition, which is a joint center between Children's Mercy, Kansas City, and the University of Kansas Medical Center. So we're really excited to be a part of that. I have a great team that I work with, and I'm going to let Natalie and Katie go, and then Robin, and then we'll turn it over to the people in the room.
Hi, my name is Natalie. I support our efforts with the Kansas City Physical Activity Plan. I'm a team member on our KC HLC team. And also support our bridge grant. Hi, I'm Dee Lee, and so I work with
Thanks. Robin?
Robin Shook, Director of the KC HLC.
Michael, I'll let you go. Yep.
Hi, everyone. Michael Kelly, Policy Director for Bike Walk KC.
Over here.
Mallory Moon. I am a research project manager at Children's Mercy. Hi, everyone. I'm KC Shield, and I'm also the Children's Mercy as a research assistant.
I'm Amanda Grimes. I'm a faculty member at UMKC, and I'm a presenter today. I'm Maddie Pella. I'm a research assistant at Children's Mercy, and I'm also a presenter today.
Corey Yeager, I'm also a research assistant at Children's Mercy.
Hi, sorry, I'm Kiki Saragnis. I work at Jackson County Public Health.
Good morning, I'm Lori Lanter. I am with Unified Government Public Health Department in Child Care Licensing, and I'm also co-chair on the Early Childhood.
Good morning, I'm Erin Kester. I work
I'm Joan Delahunt. I'm an occupational therapist. I work at Operation Breakthrough, and I'm a professor at Rutgers University.
Leah?
Hi, yes, I'm Leah Oladaton, and I'm a program manager of community health at Clay County Public Health Center.
I'm Elizabeth McGinley, recently joined MU Extension and Engagement as a field specialist in nutrition and health.
I'm Lauren Cromie. I also work for Clay County Public Health Center as a community engagement specialist.
Outstanding. That's everyone in the room. So now I'm going to go ahead and turn it to those who are online. Natalie can help.
We'll have Tatum go first.
I'm Tatum Bartels. I'm with the City of Bonner Springs. I'm the sports coordinator for youth and adult sports.
Michelle, would you like to go next?
Michelle Carmichael with Blue Cross Blue Shield, Employee Wellness and Event Manager.
Anne, would you go next?
Hi, I'm Ann Lavelle. I'm the Program Manager of Health Equity at Clay County Public Health Center.
Wow, Chris.
Chris Grallop with the Olathe School District in Olathe, Kansas. I'm the Manager of Planning for the school district.
It's Elle Fitzpatrick.
Hi, I'm Lauren Fitzpatrick. I'm a research data analyst with Children's Mercy.
Have Sandra Reese go next.
Hi, I'm Sandy Reese with Johnson County WIC.
Bryn.
Hi, I'm Corinne Glover. I'm a postdoc at Children's Mercy.
And last but not least, Teresa.
Good morning. I'm Teresa Tunstall. I'm a nurse and a health educator at Clay County Public Health Center.
Is that everyone? Outstanding. Great group of people participating today. And for those of you who aren't aware, we do record the meeting. So for those who can't participate in person or at this time, they can always go back and view the presentation at a later point. So with that, this is what you've all been waiting for. I am going to introduce our speakers and have them come up and pull their presentation up, and we'll share that with those who are online. I want to thank Amanda Grimes, Michael Kelly, and Maddie Pilla for joining us this morning. They are going to be talking about their work supporting citizen scientists to conduct neighborhood walk audits around bus stops in Kansas City. And we should have plenty of time for Q&A at the end of the presentation. So I'm going to introduce each of them in alphabetical order, and then I'm going to invite them up to get their presentation started. So we have Dr. Amanda Grimes, who is an associate professor of health sciences at the University of Missouri, Kansas City. Her research focuses on physical activity and the associated health and social influences across demographic groups. Her recent work has focused on community-based interventions to address obesity and other chronic diseases, particularly through physical activity and nutrition interventions. Michael Kelly leads Bike Walk KC's efforts to advocate for the policies, plans, and projects that make it safer and easier for people to walk, roll, bike, and use public transit across our region. He has previous experience at the U.S. Department of HUD, as well as the Overland Park Chamber of Commerce, and earned his Master of Public Administration with an emphasis in urban policy from UMKC. And Maddie earned her Bachelor's of Health Science degree from the University of Missouri, Kansas City, and has a Master of Public Health from the University of Missouri, Columbia. Her research interests include health promotion, education, and health equity. She enjoys spending as much time as possible outdoors, especially in the garden, which of course makes me extremely happy as it relates to the Children's Mercy Community Garden. That's, however, not part of the presentation today. So with that, I'm going to invite you up. I'm not sure who's speaking first. Dr. Grimes, right? No.
Good now?
Yeah.
All right. All right. Thank you, Shelley, for the nice introduction, and thanks all for joining us this morning. We'll just kind of hop right in. So we conducted a series of walk audits with community members. We're going to tell you a little bit about the broader project and how we engage those community members. Let's see, how do I advance my slides here? Maybe with the tool. Also really great at technology, apparently. Oh, I just didn't push it hard enough, maybe. Oh, it didn't go there, though.
You need a fork?
Yes.
Shelley got a fork.
This is my antenna. As I'm trying to stay off the camera too, and that's not working.
Right.
Minimize this window and go to like. Maybe the presentation might be back here. Okay, well, that works. Okay. I think this will work. All right, so kind of the impetus or premise of this larger project is really focusing on the community impacts of health. And there's a variety of ways our community can impact our health, obviously. So some of these here listed that informed our project, safety, making healthy choices, the easy choice, opportunities for healthy eating, safe places for physical activity, access to healthcare, and social connectedness. So that's really kind of the guiding principles here. Oh, okay. It doesn't change on my screen. It only changes up here. So I apologize. So the larger project that these walk audits were a part of is an NIH and EPA funded study to evaluate health impacts of the zero fare bus in Kansas City. So we're interested in a variety of ways that this has impacted health. So some of the things we're doing are using electronic health records to follow people before the policy was implemented, over time, looking at changes in those health metrics and asking them if they were bus users, kind of how often, asking them to recall back. In time, we're also interested in physical activity. So we're recruiting a subset of those to wear GPS and accelerometers to see how bus use impacts their physical activity. And then another part of this is, we want to see what are some of the additional barriers to using the bus. So these walk audits come into play where we're using or employing citizen scientists to help us understand some of the barriers and challenges of getting to and from the bus stop. So our idea is, and kind of evidence starts to suggest, that increased transit use will impact health. And so we believe that it will impact physical activity by increasing walking to and from the bus. And this image over here shows that some preliminary studies have showed that it can increase physical activity by 15 to 20 minutes per day. And if we're looking at getting 30 minutes of physical activity per day, you're kind of achieving half of that just by getting to and from the bus. And we also find that it doesn't replace other activities or exercise. So this is on top of what people are already doing. We also believe that it can improve access to healthy foods, health services, reduce some of those economic barriers. So if they're not paying for transportation, they're more likely to be able to purchase healthier foods or other healthcare needs. And then because of that increased physical activity, maybe reduce stress, we can see that hopefully their BMI will lower blood glucose, and also lower blood sugar. So we're looking at some of those things, like I said, through those electronic health records in another portion of the study. So kind of the subset, these walk audits of the current project, really looking at what makes things easier to get to and from the bus stop and makes them more likely to use public transit. And so this will obviously impact whether or not that person is going to use that public transit. Oops. And so thinking about different things that impact one's desire or need to use public transit, we can look at these different factors down here. So culture, personal circumstances, access, and neighborhood conditions. Now we're really focused on those neighborhood conditions, but I think if we look at those neighborhood conditions, those can really impact culture too, right? If it's easier to get to the bus, more people are going to use it, kind of impacts or leads to changes in our culture and community. It also increases access. We don't have a lot of control over folks' personal circumstances. So we're really focused on these neighborhood conditions for this project. So looking at those neighborhood conditions, we're really looking at the pedestrian infrastructure, availability and quality of amenities, specifically at those bus stops, safety from traffic and safety from crime. And I think Maddie's going to go over a little more detail of the elements that we looked at to evaluate those items. So to do this, we wanted to engage citizen scientists so that community members felt a part of this work, felt empowered then to use this data and advocate for improvements, and that would hopefully lead to overall community improved health. So with the community members, we had them help us inform the audit tool. So we did a lot of pre-work, really almost for a year leading up to it, or 6 months or so, creating these tools, trying to use scientific kind of validated tools, but modifying them a bit so that they were easier for community members to use. And so then once we kind of had that, after our first meeting, we asked for feedback. How can we change this tool? What would make it easier to use for you guys? Then of course, they helped us collect that data, helped us kind of refine and how to use that data, and have participated in community meetings, and asked them to help us disseminate those findings. And as you'll hear later, Michael also talked with them on how to better use that data, advocate for those changes as well. So a little bit more about our citizen scientists. So we recruited 36 community members. We recruited through the neighborhood association. They were a great help, or Center for Neighborhoods, sorry. They work with many neighborhood associations, and they got the word. So several of our citizen scientists came from the neighborhood associations. We recruited UMKC students, specifically a lot of health science students and urban planning students, just thinking that they might have a little more interest in this project. And then also Bike Walk KC sent it out in their newsletter, and we got quite a few people interested, in pedestrian and bicycling infrastructure that were involved as well. So regular community members that just had some interest in making our community a better place, really. So we did this over 4 meetings. The first meeting we did training and refinement of that tool. So we had a PowerPoint kind of going over the tool, some of the background of this project, but then we actually got out in the field pretty quick and walked through our audit tools with them in real time. The second meeting, they came back and did a little bit more self-guided walk audit. And then we kind of measured it with our key to see how well or how equivalent we were judging those factors. And then at the end, we kind of checked off, said you're certified walk audit, and we gave them, Maddie will go into this, a few walk audits to start with, and then they could come back and get other routes to do later. So they did several walk audits on their own, would bring those back. And we brought them back for a third meeting, asking for their reflections to see kind of their opinions about the process, what they learned, how have their perspectives changed. And then lastly, our fourth meeting was really kind of a celebration. We shared kind of that final packet of information with the community members, but also invited like Public Works and other community folks that weren't involved with this to see the hard work they've done and how they can use that data. So we did this with 2 separate groups, all 4 of those meetings over the period of a month or so. And everything went really well. And I think the next slide is Maddie.
Thanks. Yeah, I'm going to go into some more logistics of the details that Amanda was just talking about, and then some outcomes of our current project here. So let me make sure I can get to my notes. So, oops. Perfect. So the tools that Amanda was just talking about, we use the Our Voice framework. We kind of use that as inspiration. And so our objectives generally aligned with the Our Voice approach for supporting discovery, discussion, activation, and then community change using the citizen scientists. However, we did not use the Our Voice app for our project, and that app uses mostly pictures. So we use mostly written down observations. And the main reason that we didn't use the app was that we wanted to base ours in a research-based audit tool to support our quantitative research questions. There we go. So our audit tool was adapted from the microscale audit of pedestrian streetscapes, or MAPS tool. And we had actually 3 separate tools that we used, one for segments or street blocks, and then one for intersections and one for bus stops. And the tools captured street and land use characteristics as well as available infrastructure, so whether or not there were sidewalks available, crosswalks available, things like that. And then we added an additional piece that had more subjective items to ask more about perceptions. Oops. Keep losing my. Hit one wrong button, now it won't move forward. There we go. All right, yeah, so we asked about perceptions of people. So if they were feeling safe from traffic, they felt safe from crime, and then things like aesthetics, so whether or not there were pleasantly landscaped areas, things like that. So these are more subjective questions. All right, and this shows the area of the walk audits that we did. On the left here, it's our whole study area. We went across 10 different zip codes, mostly in lower income areas throughout Kansas City and all on the Missouri side. And then this map here on the right, the bigger map, shows all the individual bus stops throughout Kansas City. The red ones are the ones that we audited. We ended up auditing more than 250 individual bus stops and walking more than 300 walking routes. And how these worked was every walking route began at a bus stop, and then they headed in different directions toward the nearest residential or commercial areas to really get an idea of where people were walking to get to or from the bus stop. So this was more than 300 hours that it took to get all these audits done. So it was a huge undertaking by our citizen scientists. It's a lot of work that they did. And then this map just goes into more detail of the exact audits that we did. So the darker blue are the routes. You can see there's a lot of coverage. I think it was about 110 miles of city blocks. Then following all of the data collection, we had the citizen scientists bring their audit tools back to us, and we compiled all of the data into a report that we called our citizen scientist report of findings. And we really refined this through multiple meetings with them to kind of show them, like, to present the data back and just see what they thought, what was useful for them, how they could use this in their own neighborhoods, and what they wanted out of this data. So in this report, the contents are some background and purpose, what Amanda just discussed, of why we were doing this project overall, some key findings of a few indicators I'll go over in a second, maps for each individual zip code that we looked at with color-coded indicators of whether or not there were good amenities or good characteristics there, and then reflections and recommendations from our citizen scientists. And so I'll go into these key findings really briefly here, just a few. And then there were more things that we looked at than just these 4 individual things, but just for simplicity and to make it, really useful and accessible for our citizen scientists, we focused on sidewalks, crossings, bus stop amenities, and then social conditions. So to start, sidewalks. Oops. So sidewalk quality for this report was determined based on the sidewalk presence and condition. So meaning whether or not there was a sidewalk on one or both sides of the street, and then if it was accessible to pedestrians or if it had major cracks, heaves, obstructions, blocking the walkway. So whether or not the sidewalk is really usable. So overall, if you look in the report, 29% of the routes that we looked at near bus stops had 4 sidewalks, and then 5% 5% of the sidewalks on street blocks near bus stops did not have a sidewalk at all on either side, and 12% only had it on one side. The most common conditions causing poor sidewalk quality were major cracks and or obstructions blocking the sidewalk. So we saw this a lot. And for crossings. So crossing quality was evaluated for the main intersection surrounding bus stops. So that included the intersection directly near the bus stop and then along the first block coming or going toward the bus stop. Again, it was based on presence and condition. So the number of crosswalks that were located within a crossing and the overall condition, whether or not it was visible, if there was a crosswalk at all. So 77% of intersections we looked at had a bus stop, but it was near a bus stop, had crossing in poor quality. And then when considering all the intersections along the walking routes. Oh, come on. When considering all the intersections along the walking routes near each bus stop, 64% had no crosswalks at all, and then 12% had no traffic control. So there was no stop sign, yield sign, street light, anything near them. And for bus stops, for bus stop quality, we evaluated this based on the presence of certain amenities, namely sidewalks to get to and from the bus stop and then lighting near the bus stop. And this is what the citizen scientists really identified as some really important things for a bus stop to have is the bare minimum, you know, somewhere to walk and then lighting to make you feel safe at night. And then we also judged it based on the overall condition of these amenities. So overall, 44% of the bus stops that we looked at had poor quality amenities. There we go. And then less than half of the bus stops we looked at had a shelter, bench, or a trash can. And then 18% had no lighting and 8% did not have a sidewalk. And a lot of these were based over in the 64129 zip code. And that's just south of the stadium. So it's more of a commercialized area. And there was a lot of semi trucks, things like that, that we noticed making people feel unsafe when they were walking in this area. And we also looked at social conditions, and I don't have a very cool graph for this one, but we looked at, we're evaluated based on the amount of physical or social disorder that the person doing the audit saw on their walks. That include things like litter, graffiti, abandoned houses or cars. And this really plays into what I was just discussing about the perceptions question. So whether or not you felt safe from crimes, from traffic, if you're able to walk on the sidewalk. Yeah, this covered more of that. And then after presenting all of these findings to our citizen scientists, we really asked them what their reflections were, what they thought of this data. And they gave us some really interesting feedback. So we spent about 30 or 45 minutes with each group just hearing their reflections and their ideas and their wishes of what to do with the data. And then we took that information and compiled it into a summary and turned it into their wishes and recommendations. And something that's really important here to note is that they didn't expect us to solve all of the problems. They really just wanted to know how they can help, like what they can do as citizens to make these conditions better. And so then we also put these recommendations into a report. Many of our citizen scientists were already really passionate about this area, so they had a lot of insightful things to share. So it was really fun to see this as citizen scientists come together and from the different neighborhoods and missions engaged together. That's another key theme that we picked out here was a way to connect with the environment, connect with other citizens and community leaders to make a change. That's something you can see all across the board here. And then these are the maps, just to give you guys an example of what these looked like. So we created a map for each zip code. This one, there's just a couple examples here. This one is the 64106 zip code, which is primarily the River Market, a little bit of downtown, and then the Pendleton Heights neighborhood. So these maps, we wanted to make a good way to visualize this data for our citizen scientists. So in these maps, bus stops, crosswalks, and route quality are color coded to highlight the problem areas. You can see the green, yellow, and red areas. These are really interesting to look at because they showed how much variability exists across neighborhoods and even within the same zip code. And here's another map just to show this is 64109 zip code where Bike Walk KC, our partner, was. You can see a lot of, you might see good bus stop quality, but then when you head in different directions, you might see bad route quality or bad intersection quality. And then since it was our goal to make this information as accessible as possible to community members and anyone else who was interested, we posted all of this information on our website where it's downloadable and it's free to use. So this includes the report, the maps, and then the walk audit data itself. And then we also presented this data to the larger community. So the last event that we had for this project was a community-wide dissemination event, which included the official release of the finalized version of the report of findings to community members and leaders. We had a moderated panel where we invited a few citizen scientists to share their experiences, and then a presentation by Michael Kelly, who's about to talk to us again. And then we really discussed advocacy for these issues and what we want to do with this information for the future. There we go. So in summary, both the research team and the citizen scientists had many outputs to take away from this project. It was important to us to make sure the citizen scientists felt empowered in their efforts and the information they took away through the report and the maps, and made linkages to other community members and leaders, as well as knew of some actionable items that they could use to move forward for change within their own neighborhoods. And then finally, this slide just highlights some lessons learned while working on this project. Since we were working with community members to collect this data, we had to be really creative and flexible with our approach. We also had to pay close attention to the tools and the training materials that we used in order to make them as accessible as possible. Simplicity was important, especially since our citizen scientists were out in the community walking the city streets for us. So we wanted to make it as easy as possible for them to note their observations. So one major thing that we learned was that eliminating the long waiting periods was really important to maintain momentum. People were really engaged when we did these training sessions. They wanted to get started as quickly as possible, so we had to move pretty quickly. And then finally, we had a really large group of citizen scientists. So we definitely had a few champions that emerged that did a lot of the work. These are people that were eager to share their experiences and voices with others. So they had a lot of opinions, a lot of ideas for us, and it was really great to hear those voices.
One thing we didn't mention was that we did pay the citizen scientists.
Oh, yeah.
If you want to mention.
Yeah, we did pay the citizen scientists too for the training sessions that Amanda mentioned earlier. We paid them, was it $50 and then $40? So they got paid for coming out to the training sessions, and then for each walk audit they did, they also got compensation for those. Yeah. And this just shows our bigger research team here. So just some acknowledgements. And I'll turn it over to Michael.
Good morning, everyone. So again, my name is Michael Kelly. I'm the policy director for Bike Walk KC, and I'm here to talk a little bit more about our work with walk audits and specifically our work along Meyer Boulevard. Okay. So just to give you all an outline, I'm going to talk a little bit about some of the impacts of our previous walk audits, Bike Walk KC's plans on walkability in 2024, and then just some recommendations on how everyone like you can become stronger pedestrian advocates. So to begin, I wanted to talk a little bit more about the impact of walk audits and how Bike Walk KC has been able to use our experiences to advocate for changes to the built environment. So the first question that we want to answer is, what is a walk audit? And Amanda and Maddie have already done a really good job of explaining this, but in short, a walk audit is a look at the built environment from the pedestrian perspective. So very often we don't always think about what roads, what streets feel like for someone who is outside of a vehicle. And so walk audits are an opportunity for us to get that experience, especially when we don't always get that. This is actually a photo from the Kansas Active Transportation Summit in McPherson, Kansas. Has anyone been to McPherson? Okay, we got a couple people. Okay, cool. So at the Kansas Active Transportation Summit, they organized a walk audit where they actually had tools that allowed people to experience the streetscape from the perspective of someone who lives with disabilities. In this case, someone who may be blind or visually impaired. And so walk audits, again, are an opportunity for decision makers, for engineers, for planners, and for everyday citizens to better understand the challenges that people experience when they're walking or rolling to a given destination. So I wanted to talk about two walk audits that Bike Walk KC has done in the past that have helped to bring about changes to the built environment. The first one I want to talk about is I-70. So for those of you who may not be familiar, MoDOT has been working over the last few years to redevelop I-70. And the specific section that they were involved in was the segment that goes from about Paseo all the way out to about US 40 in the historic Northeast. So it cuts through a very diverse, very socioeconomically diverse portion of Kansas City And Bike Walk KC was serving on the community advisory group. That was basically the citizen side to couple with the engineering and planning stuff that was happening with MoDOT. We found out very late in the process that MoDOT had been looking entirely at maps on a screen. There had been no work to actually go out and look at the built environment, look at the various crossings along I-70 from the perspective of people who actually live there. And so we said, y'all can't do this. You can't do this major project through this community where there's a high concentration of households without access to a car and not actually experience what those people go through. And they said, okay, fine, we will let you do a walk audit, but you have 10 days to organize it. And we said, okay, bet. And so we organized with neighborhood associations, with some of the elected officials in the area, and with MoDOT and their consultants. And we were able to put on a walk audit with about 40 volunteers in about 10 days. So what we did is we actually broke out the various crossings along I-70, and we assigned a group of about 5 or 6 people here. So the folks that you're seeing here are Tony in the wheelchair and Sheila with her dog. I can't remember the dog's name, so forgive me. They are both from the Whole Person. And one thing I really want to emphasize is that if you are planning to do a walk audit yourself, always make it a point to invite people who have different lived experiences, because having these experiences helped us to see how the current elements of the built environment made it hard for Tony to be able to get over certain humps, made it hard for Sheila's dog to navigate because of how loud the street was. And so we were able to take all of those findings from the walk audit and share them with the consultants and staff at MoDOT. And they ultimately changed their plans. So they were not planning to do any major changes for pedestrians along these crossings. And as a result, they went back and modified their plans to include ADA multimodal shared use paths across several of the bridges and some of the sidewalks as well. And so that is one example of how we have been able to use walk audits to help change the built environment here in Kansas City, and we're really proud of that. The other walk audit that I wanted to highlight, which is a little bit more recent, was along Meyer Boulevard. So for those of you who may not be familiar, Meyer Boulevard is a main corridor in kind of central southern Kansas City. Don't ask southern Kansas Cityans if they think Meyer Boulevard is in South KC, because they'll say it's north. Anyway, the corridor is of particular importance because of the city's high injury network. So KC Mo, in developing their Vision Zero action plan, identified what's known as a high injury network. How many people are familiar with that? So a high injury network is basically where a city or an entity takes all of the data around crashes, serious injuries, and fatalities and puts it down on a map. And what has been found in city after city after city is that a high concentration of those crashes, injuries, and fatalities happen on a very small portion of the city's streets. So in KC Mo, for example, about 12% of the city's streets produce about 68% of the crashes, injuries, and fatalities. And so the idea is that if we're able to concentrate our investments along those key corridors, we can lower the number of crashes, injuries, and fatalities much, much faster. Meyer Boulevard was one of the main east-west corridors in this part of the city that was on the city's high injury network. And so we have been doing engagement with residents and with other stakeholders. And one person I want to highlight here is Denisha Snell. She is someone who, she is a Black woman who lives in the Citadel neighborhood near Meyer Boulevard. She bikes regularly, and she's someone who cares about her neighborhood and cares about making the community safer. And so working with her, we did outreach to somewhere between 20 and 30 neighborhood associations, businesses, key individuals, and other stakeholders. And it became very clear to us that if we want to get a better understanding of the challenges of the built environment, we need to do a walk audit. And so working with Denisha and the folks at the Kaufman School, which is a charter school located along Meyer Boulevard, we were able to organize and execute a walk audit. This walk audit was a little bit different from the I-70 walk audit because instead of looking at various crossings, we were actually looking at various portions of the entire corridor. So we did a walk audit from about Warnell Road all the way out to Swope Parkway. So that's about 2.5 miles. And so We broke people out into groups and we had them go out and look at aspects of the built environment, came back and developed a report, which we then gave to elected officials for the area, as well as some of the staff and the residents who participated in this as well. So with that in mind, I want to talk a little bit more about some of Bike Walk KC's key plans on walkability. That is, our job is to advocate for improvements to the built environment, and we have some ambitious plans for KCMO in 2024. So the first big thing I want to talk about is the walkability plan. So KCMO has a walkability plan, yay! But it was last updated in 2003. So it's a very, very old plan, and the problem with it being that old is that a lot has changed since 2003. KCMO has adopted a complete streets ordinance, they have adopted the Vision Zero action plan, and none of these policies are in alignment with the walkability plan because it came after that update. The other problem with it is that there's been a significant increase in potential funding opportunities, not only because of the GEO bond that pays for sidewalk repairs and ADA improvements that was passed in 2016, but also because of the significant amount of federal funding from the bipartisan infrastructure law. And so we've been working to try to get the city to update the plan, and we believe that this could also open the door to a Safe Routes to School plan. So the idea would be that we would potentially not only update the city's walkability plan, but specifically begin the work of coming up with a strategy where KCMO can work with the 15 or so school districts around Kansas City to develop better strategies, a better cohesive vision for making it safer and easier for students, teachers, and parents to walk and bike to school. So we are pushing for this action right now. What I can share with the group here is that KCMO is going through their budget process, and one of the things that we are working to get done right now is trying to get a budget amendment into the budget that would pay about $150,000 to update the city's walkability plan. So we will know for sure one way or another by March 28th. So please keep your fingers crossed for us. So going back to Meyer Boulevard, we wanted to continue to push for safety improvements, and a lot of this builds off of the walk audit report itself. So there were a number of recommendations based on the feedback that we got from the people who conducted the walk audits, as well as the engagement that we wanted to emphasize. So that includes things like creating safer crossings, working to address issues around street harassment, finding more ways to install low-level amenities like benches. And so working to build off of that report, we're trying to look for opportunities to push for some of those small scale improvements that will make it easier to get those broader, bigger, tougher changes like potentially a road diet on Meyer somewhere down the line. And so one thing that I did want to highlight with this, and it's really, really blurry, and I apologize for this, but KCMO has actually worked to develop a plan to install a crosswalk in front of the Kaufman School. This was one of the biggest challenges that were identified with Meyer in its current form, is that there aren't enough safe crossings. And in front of the Kaufman School in particular, it was very common to see children having to run across the street because there was no safe crossing. And so it's kind of hard to see here, but let me explain as best as I can. So in the southern portion right here, they have proposed putting a crosswalk that could, thank you. They have proposed putting a crosswalk here with 2 stop signs. And then a little bit further up, they have proposed putting another stop sign and actually closing off kind of a cut through section that allows you to get to 63rd Street. So the reason why they're proposing that specific closure of that cut through street is because this intersection as a whole has between 2013 and 2022 produced about 58 crashes and 20 minor injuries. So to put that in a dollar amount, FHWA actually comes up with a baseline number of how much a crash costs per state. It's about $43,000 for the state of Missouri as of 2018. So as a rough back of the napkin estimate, those 20 crashes at that one intersection cost KCMO about $874,000 just for that one intersection. To put in jersey barriers on each side here to help prevent these crashes and prevent people from running through this intersection is about $16,000. So $16,000 versus about $874,000. Seems like a pretty good deal to me. So what is happening right now is the city is actually working to engage with residents. They've had some initial contact with not only the city council members for the area, but also with some of the state legislators and neighborhood leaders as well. Engagement is continuing, but our hope is that they will finalize these plans and install them at some point later this year. So again, keep your fingers crossed for us. So beyond Meyer Boulevard, I also wanted to talk about Troost Avenue. So the unfortunate part of our job is that we often work with people who are experiencing some of the worst crises of their life. In this instance, Michelle Dunmore was a 59-year-old woman who was trying to catch the bus on Troost Avenue near 85th Street when she was unfortunately struck and killed by a hit-and-run driver. Her daughter, Asia, is obviously devastated, as is the rest of her family, and they want this to change, and they're not alone. We have heard from school leaders, we have heard from the local neighborhood association, I can't think of the name of it off the top of my head. Marlboro Community Coalition has asked for help. This was also in front of the Veterans Community Project, and they're another entity that wants to see these things change. So we have been working to kind of gather them, organize them, and help them advocate for changes at City Hall. Our understanding at this point is that there is a corridor plan that may be in the works being developed by members of the public works staff, and we're hoping to see something about that later this year. So yeah. So I want to close my remarks by talking about how everyone here can become stronger pedestrian advocates, but I'm sure this is a pretty easy sell for most of you. So if you're out in the community, please inform your friends and neighbors. Advocacy, one thing that we like to say a lot is that advocacy is a team sport. Nothing happens because of me, it happens because of we. And so as much as possible, it is important for us to tell our neighbors and our friends, you know, this is something that we can change. It is a lot easier to convince a council member or your state legislator to do something than it is a Congress member or your senator or the president. If you live in KCMO, consider a PIAC application. So KCMO has their Public Improvement Advisory Committee. Each year, every council district gets about $4 million, and that can be used for things like crosswalk improvements, traffic safety improvements, sidewalk repairs. Consider putting forth a PIAC application, and if you need help, Bike Walk KC can help you. The last thing is talk about this with your elected officials. As I said earlier, a lot of the changes that happen at the built environment, with your sidewalks, with your crosswalks, with everything that Amanda, Maddie, and I are talking about today is because of your county commissioners, your city council members, or your mayor. And so the reason that this isn't always a priority is because they don't hear about that from everyday folks like us. And so the more people talk about this, saying that I want more sidewalks, I want more trails, I want more crosswalks, I want more safe routes to school, the more it becomes a priority for our decision makers. If you're interested in working with Bike Walk KC, which I hope you are, please first consider signing up for our advocacy alert. So if there's something happening, a survey, a public meeting, a piece of legislation in your neck of the woods, we will send you emails to let you know, hey, this is coming up, please make a plan to be there. If you want to know more about what advocacy looks like and how you can do advocacy well, we have an Advocacy 101 series that covers everything from the basics of transportation legislation to how you can build relationships with elected officials and staff to how you can build a coalition to advocate for change. Check it out on YouTube. And finally, we recently published our policy platform for 2024. That covers legislative items that we're working on at the local, regional, state, and federal levels. If you're interested, we are happy to share that with you. And that not only includes the stuff that we're doing in KCMO, but again, stuff that we're doing on the Kansas side, stuff that we're doing in Jefferson City and Topeka, and stuff that we're doing in Washington, D.C. I'll be on the Hill next week advocating for federal legislation. So we absolutely love working with everyone who cares about improving walkability and safety for pedestrians. One last thing I wanted to highlight here is that April 23rd, we will be having Veronica Davis. So Veronica Davis is a planner and engineer by trade who most recently worked for the city of Houston. She will be in Kansas City on Tuesday, April 23rd to discuss her new book, Inclusive Transportation. Has anyone had a chance to read that book? Yay, all right. If you haven't, I highly, highly recommend it. It is a fantastic book that talks about the intersection of transportation, inequity, and community building. She'll be here to talk about the book and how we as a region can do more to improve transportation, center equity, and create better transportation systems for everyone. It's also, shameless plug, a fundraiser for Bike Walk KC. So if you're interested, please let me know and we will get you the ticket information for that. But that again will be Tuesday, April 23rd. So yeah, I think that should be everything. So thank you all.
Thank you so much. Those were great presentations. I'm going to invite all of the speakers back up here to the front since we have this gorgeous camera here to record you all. And I'm going to open it up for questions from the group. So keep in mind, questions on either of the main topics, I think would be welcome. So.
Yes.
Michael, you used the term road diet.
Yes.
Can you, I have no clue.
So a road diet is a jargon that we use a lot in transportation speak. So a road diet is where you narrow a street and reallocate space that was previously exclusively for cars for other purposes. It could be for dedicated parking. It could be for expanded sidewalks. It could be for bike lanes. This has been studied by the Federal Highway Administration and has been found to lower crashes by as much as 47% in some instances. So it's a really, really effective way to implement safer streets for everyone very quickly. Mm-hmm.
So this was all really exciting and interesting, and I'm so excited to read the report. Oh, thank you.
Very excited to read the report. So I work in Eastern Jackson County, and we have very limited public transportation in a lot of the Eastern Jackson County communities, and it comes up very frequently from community members that this is a challenge that gets in the way of a lot of things. So I'm curious if you all have thoughts about how folks could use tools like the walk audits and engaging citizen scientists and the work that you all have done together as a way to engage community members in some advocacy efforts to, work toward extending or expanding public transit and walkability into some of these like underserved areas.
Sure. So I can take that one. So the first thing is with Eastern Jackson County specifically, one thing I'll mention that we're working on now is we're working on what's known as our Transportation for All Coalition. I think Lauren is actually one of the folks participating in that. Thank you very much. And so the purpose of that is to specifically understand those challenges with the built environment, but also build a policy platform to help us advocate for those improvements locally, regionally, and state level. We know that like health departments can't do the advocacy piece, but you can connect us with the people who are experiencing those things, and we can take those experiences and share them with decision makers. In terms of using the walk audits themselves, I think a couple of things come to mind. So the first would be specifically using federal transportation opportunities. So one transportation opportunity I wanted to highlight is the Safe Streets and Roads for All grant. So that is a new grant program that was created by the federal government, and it is meant to pay for both planning and implementation grants related to transportation. A lot of communities, including some in Eastern Jackson County, such as Belton, Grandview, and I think Raytown, are using that to develop transportation safety plans, which will likely include those high injury networks. So I think the other thing would be specifically using walk audits as a means to get elected officials and transit agency folks out to these places so that they can also experience it, because an unfortunate thing that I've heard quite a bit is that a lot of the people who make decisions about transit don't actually use transit on a regular basis. And so I would just say that that would be a way to do that. And so if you're interested in talking more about doing that, I can give you my card and we can absolutely connect and talk about that more. And also, Mary Ann is fantastic. So please tell her I said hello.
And on that note, Michael, as you're suggesting to the people in the room, you can share your card with them. For those who are online, can you share the Bike Walk KC website?
Yes.
As well as your contact information or the best way to contact you, because I think it would be useful for everyone.
Oh, whoops, sorry. I will
Drop that in the chat.
I will do that in the chat. I am not always good with typing that in, but yes. If other folks have questions.
And I guess I will add, like, we're open to sharing our tools and things like that. So if that gets organized, like, we're happy to, you know, share our tools and stuff like that.
Great presentation. Question about the bus stop part of the presentation. First basic question, who is responsible for bus stops?
KCATA.
KCATA. And I assume you've shared some of the findings with them. What has been their reaction?
Yeah, so we before this full presentation was done, we did kind of some snippets of our findings to KCATA, and they were somewhat surprised at some of the findings and then curious about their own policies around some of these things. So for instance, they were asking amongst themselves, do we have a policy about crosswalks to bus stops? And they don't. And so there were some kind of low-hanging fruits, like, you know what, I feel like that's something that we can address. We can get at least crosswalks to bus stops. So they definitely identified kind of some low-hanging fruit that they could certainly take care of. I would love some follow-up with them to see if those things are coming to fruition. But I think it did definitely bring several things to their attention that they didn't realize was there until it was kind of like compiled in this report and like the visualization of it. And they also were like, can you guys do this across the entire city? And you know, our response was like, well, that takes resources, but we're happy to help. So yeah.
So like, how does that work? Like, do they do crosswalks, or does it then all of a sudden does the city public works get involved?
Yeah. So most of what happens with crosswalks and sidewalks in the city is under the purview of the Public Works Department. So they do try to coordinate with Public Works or with KCATA, and it's important to note here that one of the folks on the KCATA Board of Commissioners is KCMO's Public Works Director, Michael Shaw. So great overlap there. But yeah, in terms of crosswalks, typically it is the city that is required to do it. But in terms of anything related to the bus stop, like maintenance or fixing a sign, that is the KCATA's responsibility.
Gotcha, cool. Another follow-up. So like zero fare gets a lot of attention. I didn't see it mentioned at all here. And so how does that fit in? And like, I guess one basic question I've had seems like there's real lack of resources around bus stops and intersections and things. Would people rather have free fare and the same level of resources at some of these bus stops? Or would they say, well, we would be willing to have fares if we can get improvements to these things? Or is it not a binary choice? You don't have to choose?
Yeah, so we just did some exit polling and a survey to 20,000 Kansas City residents as well, asking them about these things. I wish we would have said, would you prefer this or this? What we did ask them is, you know, of course, we had that tax question on the ballot in November. And so we saw overwhelming support for just funding transportation with our current tax. We also asked in that exit poll, would you be willing to pay an extra 8-cent sales tax to make it a full like half cent, I think is where it worked out, sales tax, so that bus systems could be improved and we could keep zero fare indefinitely. People also overwhelmingly said, yes, I will support another tax. So I wish we had kind of like separated those if, which was more important, but we didn't. But we do know that there's overwhelmingly support to fund it more so that we can have both of these things.
One thing that I'll add to onto Amanda's point is that we have been working with groups like Sunrise Movement KC, as well as the Kansas City Regional Transit Alliance, which is separate from the KCATA. The Regional Transit Alliance is an advocacy group that works on transit issues. The KCATA is the transit authority. So RTA has been working to have conversations with elected officials in Jackson, Clay, Platte, Wyandotte, and Johnson, at least, to kind of elevate Amanda's point that there is support and that we should be looking at some sort of regional funding model, because the truth is it's not just limited to KCMO. I mean, it is something that impacts Eastern Jackson County. It impacts the Northland. It impacts all of these other parts of the region, and trying to get it, just kept in KCMO with zero fare really doesn't answer the question of how we make transit work more effectively for everyone. So.
I've got a question online and Teresa would like to unmute.
Hi, my question is.
Sorry, let me unmute.
Can you hear me?
Yes, I can hear you now.
Okay. I have been a resident of Gladstone for almost 40 years. I've called and talked to City Hall. My question is, we in the Northland, the whole Northland is affected, but Gladstone is very much affected. We have many, many big older apartment complexes that sit between 169 and North Oak. And those North Oak bus stops were critical to our population in the Gladstone and even Kansas City North area. And when they dropped all those Gladstone stops, I've only seen, and I'm out running around all the time, I've only seen 2 Iris cars. So that is not a solution. So I'm just wondering about even Liberty. We don't have a whole lot of bus stops in Liberty. And I think there's a misconception that the Northland does not have poor people. The Northland does have poor people, many poor people. And I think it's unconscionable what's happening. And I just want to know, are there talks being had between Kansas City departments and these other municipalities? And what can we as citizens do?
So thank you for the questions, Teresa. The way that transit funding currently works in our region is that each municipality comes up with a contract with KCATA to basically fund their services. So KCMO has a contract, Raytown has a contract, Gladstone has a contract. And it's my understanding that what happened in this most recent talk is that KCATA said, we need this much money to continue operating the buses in Gladstone, and Gladstone balked and said, no, we don't want to pay for that. And they basically cut it and they said, no, we don't want to do it. So if you're wanting to advocate for those things, which I fully agree, it was really, really bad when Gladstone lost that bus service. Because I have friends that live up there who have said that it's been a real pain in the neck to get around without the bus. What I would do is I would start by having conversations with the folks on the KCATA board who specifically represent the Northland. I think there's 1 or 2 people who represent Clay and Platte County, and specifically talk with them about what you're telling us here about, there are people who are living in apartment complexes who earn a lower wage, who need help getting this service. That would be a conversation just to start. But then I would also go back to the city council and say, what specifically do y'all need to hear to go back to the table with the KCATA and figure out a way to fund bus service? Because I imagine that part of the decision around eliminating bus service was had without having voices like the ones you're elevating now in the room. And so I think it's important for elected officials to hear that. It's also important for KCATA folks to hear that. And that would kind of be where I would start with those conversations. Does that make sense?
Yes, I actually talked to, and I don't remember the position. It was somebody in the city government in Gladstone, and they said the problem, and in fact, it was a front page article on our little Gladstone newspaper, that they wanted to quadruple the fee to the city of Gladstone, and they said that just was not possible. So I don't know if that is all that's involved in that, but they said that when they went to during COVID, the zero fare, that greatly affected it, that if they hadn't, they would have kept just charging, but a reasonable amount, that none of that would have happened. So I don't know what the zero fare, what impact really that had on the whole metro region.
And I've heard mixed. I haven't been able to get a clear answer from KCATA on this either, because in some instances they've said that it only impacts their KCMO service. In other places they've said that it impacts their finances across the board. So unfortunately, I'm kind of in the same gray cloud, opaque cloud as you, of trying to figure out what exactly is it, how exactly is this impacting KCATA? Because if it is impacting KCATA across the board, that's fine, but we need to have a clear understanding of that so that we can also have a clearer understanding of what specifically needs to change so that, buses can be funded and operated in places like Gladstone.
Thank you.
Thank you.
That was a great question, Teresa. And so I assume that since that's Gladstone, the walk audits that you're doing with citizen scientists would not be, none were done in that area. They were just the city of Kansas City.
Yeah,
correct?
just KCMO, yeah. And specifically, we had kind of 10 target zip codes that were kind of the lowest income, lowest life expectancy zip codes that we were focusing on, because they reasonably benefit the most from the bus service.
So a follow-up question I have about that is you showed some really nice maps that have been developed as part of this work. What is your plan in terms of making this accessible to people in the community that haven't either heard of this before or weren't able to participate in your community meetings? How can we help get the word out and get people access to those for use for advocacy?
Yeah, so we have them available on our website, and it's an individual map for each zip code. And so you can go to that report that we have linked, and I can send that to people if they're interested. But yeah, they're all available up there for download or for
What's
share.
when you say your website?
Oh yeah, it's here. I'll put it in the chat.
Okay. And I think, would it be reasonable to ask that we link our websites, or if anyone is interested, can we link our websites to that information?
Yeah, for sure.
Potentially expand our reach.
Yeah, definitely.
Great. So on the map thing, and I'm taking over for just a little bit, so if you have any questions, feel free to just raise your hand. There were red, yellow, and green coding on each of those maps. But you mentioned sidewalks, crossings, bus stop amenities, and social conditions as those things that you were measuring in your walk audits. How were the red, yellow, and green determined?
That's a great question. So basically, we kind of like a binary rating system for a couple of them, and I'm kind of calling you in a second, Corey, how we did this, but for the red and green bus stops, it was if the amenity was present and then what condition the amenity was in. And then for the routes, I believe we included sidewalks and then whether or not the sidewalks were in good condition. And then it also included some of those social condition things as well.
Yeah, yeah, that covers most of it, but it was just things like cracks in the sidewalks, obstructions. And if those were present in smaller amounts, then it would be moderate conditions. But if they're the main condition, then it was poor conditions.
And so on our walk audit, we had where they could select, right, I can't remember like the breakdown, but it was minor cracks or whatever. And then, they had a scale to say how bad they were so that then they could be determined.
Okay, so was it based on, and I couldn't see your maps quite clearly, but are there individual maps for crossings? For
So
bus amenities?
The map, it's for individual zip codes, but all those things will be on the same map. So it'll start, every route will begin at a bus stop. You'll see a bus stop icon in red or green, and then the intersections near that bus stop will be indicated in red or green, and then the routes that we walked in red, yellow, or green. But it's all on the same one map for each zip code.
And that red, yellow, and green. I guess I'm still a little unclear. Is that focused on one amenity? Is it just focused on?
Maybe we can pull up.
Crosswalk?
Yeah, let me see if I can pull this up.
Yeah, straight up.
All of them.
There we go.
And so the crosswalks are indicated by
The
the
cross,
X,
yes,
I see it.
and then bus stops by a bus, and then the actual route. And so you can see we don't have yellow for the bus stop or the crosswalks. But then in the segments, we had the yellow wherever the participants had a little more granularity to say if it was in really bad condition, moderate, or good.
The other thing I noticed as I took a look at the report, and are you okay with us sharing that report in our next
for sure.
newsletter? Great, I think it's a great one. There were some really nice pictures that were included. Do you have more pictures? So I think pictures are an outstanding tool for people to visualize really what the conditions are. Like you can tell them it's poor conditions, but until they see how bad poor is, I think that doesn't necessarily move people. And so you have those pictures on your website as well?
We have pictures from both our I-70 and our Boulevard walk audits, and we also have those reports where you're happy to share those too.
Love that. Okay, I think that's great information. What, if any, other questions do the people either in the room or online have for our speakers today?
Oh, one over there.
All right, I have another.
Here I come.
Thank you so much.
So I know at the very beginning of the presentation, you all mentioned that this study, this project was part of the larger report that's going to come out about the health impacts of the Zero Fare program. When are you all expecting for that larger report to be available? I mean, it's okay if the answer is to be determined.
Yeah, so the study is a 5-year study, and so now remind me, it goes through 2026. Is that right? I think we're going through 2026, so closer to that time.
After that.
Yeah, and so some other like preliminary kind of reports are coming out. So currently, Jordan, who is actually presenting some other work on this right now at another conference, is presenting just how like the ridership of the bus. And so we've compared it to other cities across the country that were both went kind of zero fare through the pandemic, and then those countries who cities that maintained fares. And what we see is like Kansas City maintained a higher ridership of bus riders throughout the pandemic, and we recovered quicker with the zero fare than our comparison cities. So it did seem to have quite an impact on ridership.
Are those other studies available in the same place?
Not yet.
Okay.
I'm sure they will soon be kind of getting them on websites and stuff like that. So maybe as we have updates, we can share with Shelley when new stuff comes out. Yeah.
Yes, for each monthly newsletter that we send out, we like to include some research updates. And so these would make a great addition to that section of our monthly newsletter. In fact, they'd make a great addition to our monthly newsletter in May because we will be promoting Walk Month?
Bike month.
Bike Month. Walktober, that's right.
Yes.
So, yes, we'd be happy to help get the word out about that and get people connected to this information. Okay, so the last thing I have before we take our physical activity break and give our speakers a standing ovation is who would work to update the walkability plan? Michael, that you mentioned.
So if the walkability plan, assuming that the funding gets approved, would be updated by city staff, so primarily Public Works Department and probably someone in the Planning Department. There's also a decent chance they probably hire a consultant to help with some of those aspects as well. And so, yeah, Mhm.
Okay, and where does that plan sit?
Plan currently sits, okay, so if you type in walkability plan KC it will come up with a page on the city's website that says other city plans. And so you kind of have to kind of go through that list, and it's at the bottom. And the other thing I'll note with the current walkability plan is that there's actually two documents with this. So there's the walkability plan that's like a 300-page document. It's a real page turner. But there's also a walk audit tool. So the city actually had a walk audit tool that they're using. It's pretty outdated, but it's also a really good way to kind of understand how the city wanted to inform residents about aspects of walkability. So, yeah.
Would you be willing to audio record your reading of that during the make it more easy to listen to?
I would be happy to. So just give me a studio, give me a mic, and yeah, I can do it.
That's great. Okay, my last couple of things. How does this align with the efforts of the Kansas City Downtown Council and their strategic vision, which I think is a 20-year vision for the city and connected to efforts like the Green Line, that sort of thing? And how does it connect to bringing the World Cup to Kansas City?
Okay.
Is there motivation or interest or anything to get some of this done?
Oh, the World Cup. That the whole conversation around the World Cup requires a much different drink than anything we can do here. So what I'll say with regards to connecting with the Green Line is that there have been conversations around the Green Line. So for those of you who aren't familiar, the Green Line is this kind of ambitious plan to develop a kind of downtown greenway loop similar to places like Indianapolis, which has their cultural trail. And so it would be kind of a network of trails that connect around downtown, but also kind of shoot you off into some of the other main neighborhoods like Columbus Park, 18th and Vine, Paseo West. And so the way that this kind of ties in with that work is it kind of gives KC a little bit more idea of how to prioritize their sidewalk repairs. So KC did recently develop a sidewalk prioritization plan, which is not a walkability plan. So the research that Amanda and Maddie have done will couple well with that because it will help the city to kind of fine tune where they want to prioritize repairs and potentially where they go for federal funding in the next couple of years. As it relates to the World Cup, we're going to be getting a significant influx of people, primarily people who come from much more walkable places than Kansas City. And so part of this opportunity is if we're serious about trying to invest in Kansas City in a way that makes it possible for us to continue to compete, walkability has to be part of that conversation. Multimodal transportation, transit, biking has to be part of that conversation. And so what we're hoping to do with plans and with reports like this is increase the urgency and show that it's not just something that's good for business, it's something that's good for people. And if I'm being 100% honest, we shouldn't really be planning for, how can we attract the next World Cup? We should be planning for how do we make Kansas City successful for the people who live here. So let me get off my soapbox. So, yeah. Mm-hmm.
Well, we agree, but sometimes having those types of events motivates people to make changes that they might not yet be willing to. Mm-hmm. So with that, any final thoughts, questions for anyone in the room or online? If not, I would like for all of you, whether you're online or in person, to join me in a little physical activity break through a standing ovation. Thank you so much. Okay. Outstanding. So now I think we're just going to go ahead and provide some additional updates on the Kansas City Physical Activity Plan and the Kansas City Healthy Lifestyles Collaborative. So with that, I'm going to bring our presentation back up. We'll see how long this takes. Okay. And now let me see if I can share that. Natalie, how'd that look? Great. Okay. So I want to give you some updates on upcoming sector meetings for anyone who is interested in joining our work that supports what we just heard in our presentation, but also supports other societal sectors to improve rates of physical activity as well. So our upcoming meetings, you can see we've got the school sector, Parks and Rec, and public health are coming up pretty quickly. The public health meeting is on Thursday, March 25th, at noon. Schools is Tuesday, March 26th at noon, and Parks and Rec is Wednesday, March 27th at noon. All of this information is available on our website. So if you're not already connected to these sectors, I'd invite you to do two things. Number one, complete that evaluation. You can scan the QR code that's on the agenda today, and you can sign up for any of our sectors through that. Or you go directly to our website at kcphysicalactivityplan.org, and you can find meeting registrations for any of our upcoming meetings and attend that way as well. The bottom right is business and industry. So that group is still in the strategy and tactic prioritization piece of establishing their framework. The next meeting is April 15th. That's a Monday at 2:30. I did want to highlight a few of our sectors that have what we call implementation work going on. The first one, let's see. Nope. What was your trick to getting these to advance? Okay. Early childhood, their next meeting is Thursday, March 28th from 9 to 10. That group has a couple of implementation groups or subgroups moving forward. The first one is the Professional Development Planning Committee. We are working to bring Dr. Diane Kraft, who is an expert in physical activity in early childhood, to Kansas City. We're targeting September. If you're interested in being on the planning committee for that, just let us know, but we're really excited to have that, bring her as a resource to the area. She's come a couple of times before. Actually, she's presented a couple of times before. One was in person, one was virtual. Her reach was astounding across both sides of the state line, and I think somewhere north of 150 attendees for the virtual presentation. This one will be in person, so we're really excited to have her support our efforts. And then we have included some early childhood resources on our website. You can find a link to those on the early childhood page on our website. If you have any questions, Lori's already introduced herself today. She is one of the co-chairs for that early childhood sector work group as well. Healthcare. Our healthcare sector has three main subgroups working. One is related to bringing lifestyle medicine curriculum to health professional schools. That group has a large number of participants from medical schools. We're really looking to expand bringing that information and curricula to other health professional schools like health sciences, pharmacists, dietitians, physical and occupational therapists. So if you're interested, I'd invite you to join us at the upcoming meeting. That meeting is April 2nd. For the healthcare sector, we're trying to keep our meetings to a minimum. So the sector meets every other month and the curriculum subgroup meets every other month. So they're alternating months, which is why you see curriculum meeting on April 2nd and the sector meeting on May 7th. We also host a Just Walk Walk. Those are under the umbrella of Walk with the Doc. The reason we host Just Walk is because we want to promote all healthcare professionals in addition to physicians. And so our current walk is taking place on the Kansas side. It's taking place at Mill Creek Streamway Park. We're really trying to identify how to get the information out and get attendees to participate. So if any of you are working in that area, that's in Johnson County, but it's not far, from certain locations in Wyandotte County as well. If you see families or individuals who might be interested in attending, it is free. Our walks occur on the second Saturday of the month from 9:30 to 10:30. There's a brief conversation about a health-related topic, and then participants can walk. as long as they would like, up to an hour with a healthcare professional. We are currently exploring a second walk in Kansas City, Missouri. There's already a walk going on led by UMKC through their medical school. So Dr. Stephanie Ellison hosts those walks at the Southeast Community Center in conjunction with med students. So they help provide part of the healthcare education. That's a very successful walk and has a number of participants. Again, all of these walks are open to the community. We are trying to identify an additional site on the Missouri side that would be convenient for participants. If you have any suggestions for that, we're certainly open to that. Other sectors, so this ties in directly to what you just heard. Our infrastructure sector is beginning to meet again. That group meets quarterly. Next meeting is May 13th from 9 to 10 a.m. I'm sure they will be continuing this conversation we had today and thinking about how do we keep moving forward to make both active transportation and access to physical activity easier for those through infrastructure. Faith-based settings is not currently meeting, but we hope to get them back this year. And a couple of other updates will help with that. So the first one, I'm going to turn it over, or I'm going to invite Natalie up here to talk a little bit about the sports sector and the state of play for Kansas City. Are you advancing slides?
Okay, some of you may have heard this at our last meeting. We've been doing this project with Aspen since last fall. And we're hosting our community event, which will be our summit. We're going to have it at the Johnson Arts and Heritage Center on April 8th. It's going to be a whole afternoon workshop. And it'll be hosted in partnership with the Aspen Institute and the Kansas City Healthy Lifestyles Collaborative. And we're inviting all of you to attend if youth sport opportunity and physical activity opportunities are of interest to you or your organizations. This is a link to the registration if you want to scan. This is kind of an abbreviated agenda for the event. There's going to be several panels. The first one will be about celebrating Kansas City and sports within our community already. So Kathy Nelson and Frank White Jr. will be on that panel. After they speak, we'll be unpacking the barriers to the access to physical activity opportunities in Kansas City. So we have Adrian, who is our co-sector lead for the sports sector, and he has an organization called KC United. Wesley Hamilton, he, I think, got a lot of fame and notoriety for being on the Queer Eye episode when they did a Kansas City one. And he's representing his organization, which will point out barriers to physical activity for people with disabilities. And then Christine, who is our school sector co-lead for KCK schools. She's the head physical education representative. Then the Aspen Institute will go over the data from that youth survey that we sent out, I think, starting in October. And then we'll have kids from the Kansas City area do a panel and talk about their experiences in youth sport. And then it'll be followed up with ideas for moving forward. So we'll have representatives from the Chiefs and the Royals talk about their programs, and then we'll get into table group discussions, talk about the themes that were presented during the panels, and then work as a group to talk about next steps and ways to improve access to physical activity for all kids. Robin, do you have anything to add?
This is a big deal. It's a really big deal. We're the 13th city that they've partnered with. So the partnership is a big deal. This summit, look at the people that we've got on the panel. It's a big deal. Kathy and Frank White are two of the most influential people in Jackson County. So please join us. Youth sports is a big component of it, but if you're involved in physical activity in any way, youth or adults, please join us. Just as an example, Bike Walk KC, it is going to attend because transportation is like one of the single biggest barriers to participation in youth sports. So obviously we want them to participate. And so please join us. We are looking for 100 to 150 people to attend, so.
You're welcome to share this registration information with others that you think might be interested as well. We have plenty of capacity at the Johnson County Arts and Heritage Center. It is a free event. We are just asking for registration to make sure that our accommodations can meet everyone's needs. And the other thing I'll point out, so Robin said this is a big deal. This gets us national recognition. So if we're the 13th city in the country having this done, the first in the Midwest, if I remember correctly, this is promoted with the Aspen Institute across the country. So it helps us continue to stand out as a leader in the field of, especially a promotion of physical activity, this particularly with focus on youth sport. So it is a big deal. Okay, and if you haven't already heard, we've launched our physical activity messaging campaign. So I'm going to bring Katie up to share a little bit of information about our campaign called Move Together KC, which is a campaign to inspire and promote a culture of physical movement for every body, that is 2 words, in the Kansas City region.
You covered my first part. Thank you. Yeah, so Shelley mentioned you've probably heard about this before. So it was our last quarterly meeting topic, and you've probably heard about it in one of our sector groups if you've participated before in the past. But essentially this public awareness campaign allows the personalization from individuals or organizations to include their own color brands, as well as engage in co-branding. And our hope is to spread this message to get more people to take steps toward healthier and more vibrant lifestyles. So what we're asking is for you to help us spread this message. So we want more people to get involved, bless you, more people to get involved. And so we've created these campaign toolkits for sector groups as well as organizations. And you can access these on our Kansas City Physical Activity Plan website or go to movetogetherkc.org. And when you do, and you share these campaign messages on your social channels, we ask that you tag us using the @ symbol. So at Move Together KC, in addition to our hashtag Move Together KC. And if you haven't already, we would love for you to follow our own social channels by scanning the QR codes. Thank you.
Do it now.
That's
Open up
right.
your phones.
I am leaving this up here to allow you plenty of time to go on and follow us on both Instagram and Facebook. We may have other channels that come in the future, but we really are trying to drive our participation in these social media channels so we extend our reach. If you go on our website, you can also find, I believe, a link to submit your own video about why you're physically active. Tell us your story, and if you follow us on social, my word, follow us on social media, because that's better than listening to me talk. You can start to see the stories that we're going to be sharing from people who live in this community about how and why they are physically active. Okay. I'm going to skip the website part, and I'm just going to turn it over to well, first of all, I'll pause for just a second and see if anyone either in the room or online has any questions about what we've shared already. If any of you have tried searching for Move Together KC and see what comes up. We had a couple of hiccups this week with getting that launched and making sure that was directed to our website, but we think we've got those fixed. And if there are no questions, I invite anyone else to share updates that they may want everyone to know about, whether that's events, activities, shameless promotions.
I can offer one more thing.
Please do.
Yeah, so One thing that was required with the bipartisan infrastructure law that we wanted to make sure folks were aware of is each state was required to develop what's known as a vulnerable road user safety assessment, or VRUSA. That is basically a snapshot of how they understand the issue of traffic violence in their state and what specifically they're doing about it. Bike Walk KC took a look at both Kansas's and Missouri's. Kansas is better. But if people want to learn more about that, please feel free to reach out. I'm happy to share information we found about that.
Thank you. Anyone else?
Erin and I will be participating next week at an early childhood program that's having an open house, and we're going to be presenting with the 1, 2, 3, 4, 5 fantastic. So anyway, just a little update on that. It's not dead. Please continue to spread the word about fantastic.
I just want to tell you, I'm sharing my research that I did with the physical activity learning session. We did it with some staff at Operation Breakthrough last year. And so I'm going to share at the American Occupational Therapy Association's annual conference next week in Orlando. Yeah.
Outstanding.
Yeah. Sure. Always.
Anyone else? Any other updates? Anyone online and have an update they want to share with the group? You should be able to just unmute and we can hear you. Okay, it doesn't sound like it. Well, I want to make sure you have plenty of time to access this evaluation. For those of you who are in person, you'll have an evaluation QR code on your agenda, so feel free to grab that or scan the one that you see on the screen right now. That gives us, we do read those and we do take that information and we do update, change, improve our meetings using that. It's also a way to sign up for the sectors and get more information through our monthly newsletters. There is an additional opportunity to get more information about the community garden that we have at Children's Mercy, to engage in volunteering with that, or simply get more information about gardening through our garden newsletter. And then last but not least, in honor of spring and St. Patrick's Day on Saturday, I wanted to include a little Irish workout for you all that involves more than just lifting pints. So if there's nothing else, again, thank you all for attending today. We really appreciate you having attending and coming. Our next meeting will be Thursday, June 6th. And as we secure speakers and information, be on the lookout for that. It will be here again. Happy spring break. Have a great rest of your week.